Hi everyone, my name is Anna. Thank you so much for being here with me today. If you're new here, hi and welcome. Thank you so much for being here. If you're a returning subscriber, as always, thank you. Thank you for supporting what I do. And essentially what I do is to try and just share what God puts in my heart and what I come across, just so we can build each other up. And we can make each other better. So today I am holding my phone because I want to cover a topic that I don't want to leave anything. And it's a topic that is very close to my heart. And that's that as a doctor, I know it's important for you to hear this, and more so if you need this, okay? So just the other day was the Am I Okay day, and essentially it's sort of a day for you to reflect on what's going on in your life, where you're at in your life, your struggles, your failures, and obviously things that your mental space. It's just sort of to recognize if you need help, and to recognize and be aware of what is going on in your mind. Remember, it's okay not to be okay, and remember it's okay to seek help if you need help, and remember a lot of the mental conditions that we currently have treatment, and you can lead quite a successful life, and we don't want to lose people, because obviously with mental health there's always that risk of suicide intent and loss of lives if things are not sorted quickly. So thank you so much for being here, and I hope this topic is going to be very beneficial to you. And if you haven't watched my topics before on Am I Okay, how to recognize signs of depression, and also how to, the myths associated with mental health, please search for those just under my name, Migrant Dr. Mom, and you'll find that information that you so require. And as always, if you like the content, remember to share, like, and if you have questions, I'm more than happy to engage. Okay, so what am I talking about today? Today is essentially, as a general practitioner, is to give you a bit of tips on preparing to see your doctor about your mental health. So essentially is making that appointment, your mental health appointment, and what you need to arm yourself with, what are some of the things that are helpful to discuss during that appointment, and just to make sure that your appointment with your general practitioner is meaningful. So congratulations if you're thinking of making this appointment. It means that you're thinking about yourself and you're thinking about your mental space. And it is okay. You're not a weak person to seek help. It just means you're somebody that recognizes the importance of your mental health. And really, I want to commend you if you're thinking about making this appointment. So what are some of the things that you need to prepare to discuss with your general practitioner when you have this appointment? Remember, and especially if you live in Australia, you know how our appointments with our general practitioners are. You do have the standard appointments, a longer appointment. I would always recommend to make a longer appointment. You don't want to feel rushed in an appointment, because remember, the longer time you spend, it's at the expense of another person, and obviously that just spirals over to your poor GP, who's running, wants to understand you, but at the same time has other patients to look out for. And also, you don't want your appointment to just rush through and you're told come in 2 days' time or come tomorrow, So just make a longer appointment, having in mind that these conversations can be quite emotional. We need to give you time to process your thoughts. We need to give you time to be able to give us a comprehensive history, and so that we can know how best to assist you. And your general practitioner would have adequate time to help you out, and obviously to plan on their next the next processes that are involved in doing mental health consultations and mental health plans. The next thing is think about whether it's helpful to take somebody with you, take a partner with you, because there's some things that when you're going through, you may not recognize that you're going through this, that maybe you're being more irritable than usual. If your husband may have noticed that you're struggling a lot in the area of financial management, you're spending more. And to be honest, some of these conditions like bipolar, you may not even understand that this is what is happening. You may not even understand that you've been more irritable with your kids and your partner. So it's very, very important to think about whether you need to tag along somebody that you trust and that's somebody that can give a bit of additional information if called upon. And then obviously the third thing is make a dot points, dot points of the things that you want to talk about. Remember things like your sleep, that you can't sleep. If you notice, that you're not interested in your normal hobbies, those are the things that your GP need to be aware. If you've been having, some thoughts that are not right, that are dark, you're in a difficult spot, these things need to be noted down because they will be helpful for your GP to make, appropriate decisions about your health. And it's very important because obviously, like I always say, if these things are not tackled, they can have quite detrimental effects. And then the other thing that's quite important is try and notice how long this has been happening, because the duration of your symptoms are quite important and can differentiate whether you just have an acute stress disorder or whether that's now progressing to, depression. And, so it's very, very important to note down these things, how long this has happened. Is there a trigger? Is there something that could be, linking up with whatever it is that you're going through? And obviously, if you've had any previous treatments, this is very important. What has worked in the past? What medications have worked? Were you on something, some medication that you took for a certain period of time, felt better, and then when you stopped and you're going through something, you're struggling a bit more than usual? These are very important things for your GP to know. If you've ever required, like you've been really in a very bad state, required medical admission, if you've required any admission to a psychiatric unit under the mental health form, it's very important to tell your GP this, because that information is going to be very, very helpful to know, even if you have seen a psychiatrist before, who are they? If we need to send you back to them, we know who will be sending you back to. So just be as candid as possible. Remember, your GP is just somebody that's holding your hand along, and at the end of the day, we want to be able to offer you the best service possible. The other important thing that is quite important, if your GP doesn't ask, is if any of your family members has been affected by this. Okay, so it's very, very important to know if you've had a family member with a similar experience, if you've had a family member that has, unfortunately not managed things well, if you've had any unfortunate losses in the family because of mental health. It's very important to come out with this, because again, like I said, that will be helpful to make sure that we do things right for you. And then one other, I don't know whether it's the 6th or the 7th point really, to be honest, is how is what you're going through affecting your daily life? How is it affecting your work? How is it affecting your relationship with your spouse? How is it affecting your relationship with your children? Are you sleeping more? Are you using the family resources more? Are you not engaging, if it's a couple, if you're not engaging in things that couples should engage in, such things are quite important, to be able to let your general practitioner know as well. And then the next point is, if you're taking medications, it's quite important to tell us what medications you're on, so that we can look at the side effects, look if we need to up the dosing, look around and see if there are any interactions that could be happening with your medications. So essentially, that's another good area to be able to talk about. And then obviously, if you're struggling enough, and I always, tell my friends and people that are close to me, my patients, if you're struggling enough and you're starting to see that this is affecting your work, it is okay to ask for a medical certificate. Okay, it is okay to ask for a few days off to sort of just, work through your emotions and probably make appointments with a psychologist to sort of help you out. It may not be like a very long, time off work, but I think it is essential. It is very essential to be able to be at a good mental health space, to be able to, engage with psychologists, to engage with your work, and also just to be, to think about, your mental space and where you're at. Remember, your GP may recommend what we call a mental health plan. This is, something that we do it quite a lot, and we do it because it offers you, under the Better Access program, it offers you an opportunity to seek psychological support for what you're going through under Medicare, so that you get a bit of subsidized cost. I know a lot of my patients come and say, I was told it was going to be free. It is not entirely free. There are some psychologists that may actually have no gap, but I do understand a lot of them have a gap. It just makes it come down from, some people charge as high as 200 and something. It may just come as low as, getting charged for like $50 or something. So essentially, quite important to get that done. So then that way you can seek support that you need. Remember, with your GP, you'll probably be spending 15 minutes. If it's a long appointment, 20 minutes and above. And you may not have enough time with them to walk through what's going through. And again, they are not specifically, trained in the psychological sort of finer components that a psychologist is trained in. So make an appointment with a psychologist through your mental health plan, and that will give you even up to 45 minutes where you get in, talk about your issues, come up with strategies on how to help, psychotherapy, motivational interviewing, cognitive behavioral therapy. All these are practices that your psychologist can use to help you navigate life. And to be very honest, a lot of people may not even need medications. It's a lot of people may actually just be needing that, because if there is a non-trigger and, you can work through things with your psychologist, and obviously the psychologist is in constant communication with your GP, then by doing that, you can get all your much required help. So as you leave the practice, your consultation room with your GP, remember to make another appointment for follow-up, just so that, your GP can see where you're at, can see whether, the interventions put in place are working, or whether they need to be thinking about, optimizing your medications, referrals to a psychiatrist, and, and doing a few other things. So congratulations if you're thinking about making this appointment, this very important appointment. If you have a friend that has been thinking and is sitting on the fence, just let them know. Most of, the GPs will not judge you. In fact, we are there to support you. We are there to hold your hand. We are there to make sure that you quickly work through whatever is going through. And obviously, we are there to offer referrals to the respective people that need to be involved in your care. And like I always say, guys, we can work together, and we can stop loss of life through mental health. We can stop the stigma that's associated with mental health. And it's okay not to be okay, but seek some help. Please remember to share this. It is very, very something that's very close to my heart. It's something that I really want people to know, that they can see someone. And if you're struggling financially, talk to your GP about it. There are people that are very understanding, and if that needs to be put onto Medicare by a bulk bill, a lot of them would be happy to do that. Obviously, based on your current situation that you're going through. So you take care, guys. Remember, life is worth living, and remember, there is help. Thank you so much. I'll put in a few things, links, Blue Line, and all that can